is going to talk about a wonderful wellness program that you guys have just launched at Body Allure.
You know, Cindy, 3.5 years ago, we launched LipoDissolve at Body Allure, and thousands of treatments and thousands of patients later, we're the most successful LipoDissolve provider in a 6-state area. Now we have another milestone, and I'm so happy I can announce it on this show. It's called the HCG diet, and again, we're the first physicians to bring this to Kentucky, and it's a wonderful, wonderful diet, and you lose a pound or 2 a day.
Now, this is a diet that has to be the HCG diet. It has to be supervised by a physician.
Everything we do at Body Allure is physician run, and the way this diet works is really simple. If you think about the thermostat in your house, when you crank it up when you're cold, what HCG does to your body is it cranks up your fat thermostat.
Okay.
And what happens from your fat thermostat being cranked up is that you lose between 2,500 and 4,000 calories of fat only a day. And what that means is your fat, you're going to lose a pound to 2 per day. All your energy and nutrition is going to be coming from your fat being burned. The result of that is your body is going to be totally resculpted, because you're going to not only lose a pound to 2 a day, but it's going to only be fat. So it's going to be in the areas where you're fat, your belly, your hips, your thighs, wherever you have fat pads, that's what's going to come off. And so you're not only losing weight, but you're resculpting your body at the same time. And our patients tell us that their energy level is much better, they can sleep much better, they're less irritable. And it's just an incredible, incredible diet that we've been doing a couple of months and have had great success with.
So, how do you, is it a food product?
It's a real
program?
simple diet. It's the simplest diet you do.
Okay.
You have to give yourself an injection once a day.
Okay.
And we instruct you how to do that.
Okay.
You have nothing to eat for breakfast. It's simply coffee, tea, or water. For lunch, you have 250 calories of a specific menu.
Okay.
It's usually a salad, a fruit, and 3 ounces of either chicken, veal, white fish, or beef.
Okay.
And you have the same for dinner. You eat nothing else, okay? You don't exercise on this HCG diet, because you're only taking 500 calories a day in, because your brain has been tricked by turning up your fat thermostat, so you're not hungry.
Okay.
The first couple of days while you take your injections, we have you load up on fat and dairy products and sweets and everything you like. And then day 3, we have you go to the 500 calorie a day diet. Now, we see you once a week, and we only give you a week's worth of injections because we need to monitor you closely, obviously, on this diet. But the results have been credible. You can do it for 24 days. You can do it for 40 days. After you do it, you can wait a month and then repeat it again. And we have just seen incredible, incredible results, and we're super excited about this.
So this is for a particular patient of yours? I mean, what's your typical client that would benefit most from the HCG?
Someone that comes in and says, you know, I want to lose 15 to 20 pounds in a month. I've got to do a runway show if I'm a model, or I'm getting married, or I'm going to a big event, a bar mitzvah, or whatever it may be. I've only got a month to do it. How can you take off 15 to 20 pounds? The other type patient is the one from our wellness program that needs to lose 150 pounds. They've lost 50 or 60 and their body kind of stalls like it always does. And instead of getting them down and depressed, we put them on the HCG and they lose that 20 or 30 pounds more, and then we put them back on our wellness program diet.
Okay.
Those are the 2 main people that we're seeing for this.
Okay. And of course you offer lots of other services at Body Allure. You talked about the LipoDissolve.
Right. The LipoDissolve, you know, has just been fabulous. Why are we successful, and why are we basically the only guys still doing it? It's because, number one, physicians only administer it. Number 2, we use national protocols. And number 3, we're the only ones that use the ultrasonic treatment for our LipoDissolve, which has made us immensely successful in it. We still have our smooth shape laser, which is the only FDA approved laser in the state of Kentucky to specifically burn out cellulite. We still have Botox at $9 a unit. We do our facial fillers. Our huge wellness program is just expanding, and the HCG is addition to that. I'm happy to announce that a week from tonight on WAVE, Lori Lyles will be showing a special on us on andropause and on our testosterone that we've been doing. And you know, the wellness program is finally doctors are figuring out you don't treat people when they're sick. You treat them while they're well so they don't get sick. So you come on our wellness program and we can help you either prevent high blood pressure or diabetes, or if you already have them, we can decrease the meds you have to take for them. In addition to losing weight, it's a holistic approach where we treat the inside and the outside of your body.
Well, and of course, when you talk about things like obesity and the associated diseases, you also have to talk about the mental health.
Right.
People that suffer from obesity also tend to suffer from depression, and it's just a big
It's a cycle. It's a big snowballing cycle, and now we can treat the hormonal part of your body, the endocrine part of your body, the physical obesity or fat pads, your cortisol levels. We do it all in our wellness program, and it's been amazingly successful. You know, last time we added the testosterone for men. This time we're launching the HCG, and it just continues to grow.
Okay, so if you've got questions about HCG that you want to ask Dr. Samuel, our telephone line is 571-5263, 888-892-83. It's new in town, and he can answer any questions that you might have. We've got a few already on the line if you want to go ahead and get to a couple of calls.
Love to.
We'll go to Jenny first. Jenny, do you have a question for Dr. Samuel?
Yes, I've been sitting on the line, and I kind of think he answered it, but I just want to make sure.
Okay.
I'm very well overweight, very much. I need to lose at least 200 pounds. And I do have sleep apnea, and I'm on my CPAP machine for that. And I've, tried to lose weight, but I just can't. And when I go to the doctor, he says, you've got to lose weight, because I've had a double bypass a year ago.
Oof.
So I just definitely need to lose weight.
Well, you're the ideal candidate for our wellness program, and it's a very, we spend about 45 minutes on our original consultation because we really get a complete, detailed medical history of what you've had in the past, what surgeries, what medication, what lab tests we need to do, and we would put you in our wellness program, and at some point in time we would add HCG to it.
Okay. All right, Jenny, thank you so much for the call. And of course, the telephone number at Body Allure is
327-9418, and our website is bodyalluremd.
Okay, .com. All right, we're going to go ahead and take a real quick break, and if you've got questions right now for Dr. Samuel, you can give us a call. 571-5263 is our telephone number. We'll be right back with Listen Live. Stay with us. Welcome back to Wave 3 Listens Live. Thank you so much for joining us. The lines are lit up. So we're going to go right to the telephones with Dr. Steve Samuel with Body Allure, talking about his new program, HCG, if you've got questions. Mary, do you have a question for Dr. Samuel?
Yes, I do. Good morning. I have chronic pancreatitis, and I would like to know how that relates to this diet. Fat is the problem in the diet with pancreatitis.
Well, this is the diet for you because this burns 2,500 to 4,000 fat calories per day. And your diet will consist of no fat, and you will lose weight, which will help your pancreatitis. You'll have no fat in your diet, and you'll burn the fat off. So this is perfect for you.
Well, one thing I do not need to lose is more weight.
Okay.
I've lost 63 pounds with this pancreatitis.
Well, then you need to come in and check out the options on our wellness program so we can get your medical history and get you into our wellness program.
Well, thank you very much. That's a glimmer of hope.
My pleasure. Give us a call.
Mary, thank you so much for the call, and best of luck to you. We're going to go to Vicki. Hello, Vicki.
Hello.
What's your question?
I have had the stomach surgery to lose weight. It is called the vertical banded gastroplasty. They don't do it any longer now, and I still watch what I eat and what I drink and stuff like that. Now, will this HCG diet help with me? Because I'm like kind of at a slow point.
You are the ideal candidate. We have a lot of bariatric patients on our wellness program, and a lot of patients that have had the gastric surgery, whether it's the lap band or the bypass or whatever, they still need to lose weight, and this is the easiest, simplest, safest way to do it in a short period of time. And I highly advise you call us and we can get you right on it.
All right, Vicki, thanks so much for the call. And Nicole is next. Hello, Nicole. Do you have a question for Dr. Samuel?
Yeah, I was wanting to know, how do people keep their how do they keep the nutrition for their body if they're cutting out so many calories into their body? I'm pretty athletic, and I want to know how to lose like 20 to 30 more pounds, but I want to make sure that I'm not losing the nutrition I need to keep myself, with energy and things like that.
Right.
Well, again, this diet is super because it burns your fat, and that's how your nutrition and energy are created, by burning fat calories instead of other calories, and that's why your body reshapes, because it loses fat. Now remember, although you're only having 250 calories for lunch and for dinner, those calories consist of a fruit, of a vegetable, and either a meat, fish, or white chicken breast or veal. So you're getting a lot of the calorie groups, you're just not taking a lot of the calories in, and what we're doing is burning your fat calories, so it's very healthy.
I had a biochemistry professor one semester who said that you get more bounce for the ounce when you're burning fat, because there's 9 calories in a gram of fat.
That's exactly right. That's why you lose 1 to 2 pounds a day, because you're burning 2,500 to 4,000 calories of fat only per day on this diet. So if you've got fat pads, they're going to be gone and resculpted and reshaped.
All right, Nicole, thank you so much for the call. We do appreciate it. And we're going to go to Rebecca now. Hello, Rebecca.
Hello. I'm a breast cancer survivor, and I had a question. Is it really safe for people who are living with cancers and other medical problems? I'll hang up and I'll listen to your answer. Thank you.
Well, again, we do a complete medical workup on you. And it's a long, long consult that's detailed. It includes a physical exam. It includes your past history. We know the blood work you've had, the medicines you're on, the surgeries you've on. And we'll tell you after evaluating you whether you're a candidate or not. And I can just say we do have cancer patients on this. The only people that wouldn't be a candidate is if you have cancer and your nutrition is so poor that you need other forms of nutrition and you don't need to lose weight but you need to gain weight, then obviously HCG won't be for you.
Okay, thank you so much for the call. We're going to go to Mary now. Whoops, if I hit the button right. Hi, Mary. Mary's calling from Elizabethtown. Mary, you with me?
Yes.
Okay.
Thank you for taking my call.
Sure.
I guess my question was a lot along the line of what everyone else is asking, and that is, if you're on medication, what kinds of medication would it, affect? And, because I'm so weak already, from all this medicine.
Whoops.
So, I was wondering, is this going to make me weaker?
Well, there's certain medications you can stay on, and there's a few medications that you would have to come off of. Again, that's part of our initial 45-minute complete consult that we go over. I will tell you, with the HCG diet, you will feel better, your energy will be increased, your stress will be decreased, your sleep will be increased, you're going to lose body fat, and we just simply have to have a list of those medications and go over them one by one and tell you which ones you can stay on and which ones you can't. If you come by, we'd be happy to look through that list with you.
All right, Mary, thank you so much for the call. We appreciate it. We'll take probably one more before the next break. Hey, Michael?
Yes.
Good morning.
Good morning.
What's your question for Dr. Samuel?
Yes, Dr. Samuels, I have a question for you. You spoke earlier about the testosterone. Is that just for men, or does that have to do with women as well?
Well, actually, we're implanting testosterone pellets in women now. We have to get a baseline saliva test to get your complete hormonal history, and based on that history, if you're low on testosterone, we implant it in women, and we've done several women with amazing results.
And of course, you also have more men coming into the practice all the time because...
All the time for, the testosterone and the weight loss and, the HCG. More and more men are coming in because they're getting less afraid to come to the doctor early because they understand this is something that's going to make them feel better both inside and out. It's going to give, the testosterone, they're so much more focused at work. Their energy level is so much better. Their libido is so much stronger. I mean, there's no downside. We don't have anybody that can come back for more pellets, let me put it that way.
All right. Okay, Dr. Steve Saniel is joining us today. He's taking your calls if you've got questions about the new HCG diet that they have at Body Allure. It's a revolutionary program, if you will, wellness program. We'll take those calls, 571-5263. We've got plenty of time to get you on. 1-800-888-9288. 800-9283 is the toll-free number. Go ahead and give us a call right now. We'll be right back with Listens Live. Welcome back to Wave 3 Listens Live. Dr. Steve Saniel from Body Allure is joining us today. And just to clarify, tell me what HCG stands for.
Human chorionic gonadotropin. Big fancy medical word. When you're pregnant, you hear about it a lot. But it's a luteinizing hormone. It's a gonadotropin, and it affects the part of your brain that's your fat thermostat called your hypothalamus. Those are all big medical words, but basically it's a naturally occurring hormone. This is not something made in the lab. This is something that your body makes. It's a naturally occurring hormone. We just trick your brain into thinking that you need to really burn up fat, and that's why you burn up 2,500 to 4,000 calories of fat a day by the HCG turning up your fat thermostat in your brain.
Okay, so the drug that you're injecting is actually what's burning the fat. You're also not consuming very much fat at all.
At all, right. As I mentioned, you're going to have a vegetable, you're going to have a fruit, and you're going to have 3 ounces of chicken breast, veal, white fish, or beef for lunch, and that's all you're going to get, and the same thing for dinner. And there's no cheating. There's no, can I do this? No, the answer is simple, no. You get what on this one sheet of, we give you a sheet of paper, and it's got everything you can eat and when to eat it, but nothing outside that list are you allowed to eat, but you're not hungry because your thermostat and your brain have been tricked with the HCG.
Okay. Do you need a test patient or anything?
Come on, guys.
Okay, let's go ahead and get to a couple of calls. We'll go to Phyllis. Hey, Phyllis?
Yes.
Do you have a question for Dr. Samuel?
Yes. About how expensive is this?
There's 2 programs. One's a 24-day program, and it runs $500. One's a 40-day program, and it's $700.
Okay, pretty simple.
Okay. That's what I was wondering about.
Okay, Phyllis, thanks so much for the call.
Okay, bye-bye.
I'm sure a lot of other people were, so thank you so much for calling in. We're going to go to Janet now. Hi, Janet.
Hi. I wanted to say a quick thank you to Dr. Samuels. He did an emergency appendectomy on my husband, and he was wonderful.
Oh.
But anyway, my question is, I suffer from a severe chronic headache condition, and it's almost daily, and it's completely debilitating, but I can't exercise in any way because that worsens the headaches. And I see a neurologist and a pain management doctor, but I was wondering if, I've tried everything, and I was wondering if they treat anybody with that, or even if a diet, I followed the Headache Institute diet, but that didn't seem to work, but I was wondering if he had any suggestions, or they do anything like that, but I do need to lose weight also, and I do take a lot of medications.
Well, that's my question. Number one, do you need to lose weight? And number two, again, we'd have to review your medications, because if you're diabetic or hypertensive, or if you have problems with your bone and joints, if we take weight off you, all those things will improve. If you have sleep apnea, that's going to improve because you're going to lose weight. It's a big wheel, and once we get you to lose weight, everything else on that wheel follows cycle, and it improves by losing the weight.
So the question would be, too, I suppose, if you go on the short program, if you will, Does your fat just start coming back?
No, we transition you into our wellness program and
Okay.
teach you how to eat one of the other diets and
Okay.
how to eat, when to eat, what to eat. So we don't just say see you after the HCG. After the HCG, you begin our wellness program, and it's a 12-week cycled program where we see you every 2 weeks and help you transition back into food, but we teach you how to eat that food, when to eat that food, and people are doing great on it.
Okay. All righty, let's go to Shirley. Good morning, Shirley.
Yes.
You're on the air.
Okay, my question is, I'm 71 years old, and I'm on blood pressure medication, and I have back problems, and I wonder if there's anything dangerous for me to do this diet.
Well, do you need to lose weight?
Yes, about probably 50 or 60 pounds.
Well, you need to come see us because you are one of many people with the same story that you've just related, and I appreciate you being honest and relating that story to me, but all those things are helped with weight loss, and HCG would be a wonderful way to kick you into our wellness program.
Okay, thank you so much, Shirley. And I'm sure that you find that a lot of your patients, once they lose that weight, they're so motivated that
Well,
they
what
are
happens,
able to...
they lose the weight, they start to exercise, then they want us to do the lipodissolve on the inches that they couldn't take off, and then they want to do the Botox and the facial fillers because their self-image is so much better, and they're feeling so much better about themselves. It's just a total holistic approach where, again, we fix your outside and help your inside, so it's a whole body type situation.
Okay. All righty, a couple of more calls here real quick. We're going to go to Pam. Hey, Pam.
Yes.
You're up.
Yes, I was wondering that if you have severe osteoporosis, if this would be beneficial, and also what is the cost of the consultation?
Well, do you need to lose weight?
A little bit around the hips.
Yeah, in our wellness program, again, there's supplements that make up about 25% of our wellness program. You know, we put you on a diet. That's about 25% of the wellness program. We put you on an exercise routine. We put you on supplements, and we put you on one of our 3 prescription FDA-approved medications. So the answer to your question is we have wonderful supplements for osteoarthritis and bone and joint conditions. And as you take the supplements and as we take the weight off you, it's just that wheel again. You're going to all together get on that cycle and feel so much better.
All right, Pam, thank you so much for the call. We appreciate it. Nancy, you're up next.
Hello?
Hi, Nancy.
Yes, I was wondering, is any of this covered by insurance?
Well, if you are obese, meaning your BMI is over 30, we give you the codes to file with your insurance company, and most of them are reimbursing you. We don't take insurance unless you're on a flex account or health savings account. We do take that. If you're not on that, we charge you and tell you how to bill your insurance company yourself.
Okay, and I want to ask you, is this like the human growth hormone, or is this totally different from that?
That is a totally different topic.
Okay, I didn't know. I was just wondering. I missed the first 5 minutes of your show. How is this? How do you take it? Is it a pill? Is it a shot? How do you receive this medication?
It's a shot that you take once a day. We show you how to take the shots, and we give you a 1-week supply, and we see you weekly. It's very simple to do, and again, we have nurses and doctors that will instruct you on how to give yourself an injection, but you do take 1 injection per day.
Where do you do the injection?
Most people do it in their thigh.
Okay.
Yeah, most people do. Some people do it in their belly, but most people do it in their thigh. Just because it's simpler to look at your thigh and give yourself an injection than depending on how big your belly is.
I'm not
but
so sure that I could do
it's a
it
small
either way.
needle. It's a
Okay.
very small needle, and we've had no problems with teaching people how to do this.
Okay. All righty. Thank you so much for the call, Nancy. We appreciate it. And Lori is next. Hi, Lori.
Hi. My question is, I'm on psychiatric meds, and especially one of them makes me extra hungry and gain weight, but it's like a miracle pill for me, so I don't want to go without it. So that's my question, I guess.
Well, again, we're going to find out what that medication is. We have a large number of people that are on what you call psychiatric meds, what some people call antidepressants. And to be honest with you, most doctors aren't focusing on weight loss that are treating your psychiatric problems, but we have psychiatric medicine and antidepressants that decrease your appetite, and we would call your physician and ask if it would be okay to switch up a couple of your medications if necessary, and they've been very, very good about doing that with us.
All right, Lori, thank you so much for the call. We're out of time with Dr. Samuel for now, but if you've got questions, you can call the office at 502-327-9418, or you can go online. BodyAllureMD.com is the website. You can find out all about the new HCG wellness program as well as all the other treatments that are offered at Body Allure. And thank you so much for coming in
Always
today.
a pleasure, Cindy.
It's good to see you. Stay warm. Stay
I will.
out of
I'm going
that
to do my
snow.
best.
Okay. All right, when we come back, we're switching gears. We're going treasure hunting. We're going to the Crystal Heart Ball and the Fur Ball, too. How about that? All kinds of stuff coming up. Stay with us. We'll be right back with Listens Live.